regular meeting of the Anson County Board of Commissioners to order at 6 o'clock. And we will start off with with a moment of silence, honoring the memory of Mr. Joseph Eugene Joe Dutton, who was our tax collector. He was also a director of the board. He was director of the Anson County Chamber of Commerce Board of Directors. An Anson County businessman. He was well known and respected throughout the county. And I'd also like to add to that Mr. Richard L. Spencer Jr., who was born and raised here in Anson County, lived here for a while. He was a Grammy Award-winning musician. He got a Grammy in 1969 for the song Color Him Father. He was an educator here in Anson County as well as a preacher. So this time we'll have a moment of silence.
Mr. Woodburn and one of my seniors, Miss Betsy Lee Ingram, that was well respected. She turned 100 years old last Saturday, and she left us New Year's Day.
Okay, thank you, Mr. Sturman. At this time, we'll have a moment of silence in honor of the memory of these three Ansonians. Thank you. Okay, the next item of business is and let me back up. We have Dr. Sims, Commissioner Sturtevant, Commissioner Bricken on the phone, and I think Commissioner Smith may be sick, so he's not called in yet.
Yeah, I'm on my commission.
Okay, at this time, we have the approval of the agenda, and preceding that, in accordance with the State Government Ethics Act, General Statute 138A, it is the duty of every board member to avoid both conflicts of interest and appearances of conflict. Does any board member have any known conflict of interest or appearance of conflict with respect to any matter coming before the board? If so, please identify the conflict and refrain from an undue participation in the particular matter involved. Does anyone have a conflict? Okay, hearing none, then we'll move on with approval of the agenda.
I make a motion that we approve the agenda.
Okay, we have a motion from Commissioner Sturtevant, a second from Vice Chair Sims. Any discussion? And all in favor, let me know by saying aye.
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 Let's see. I only heard
We started with
Sturtevant.
Aye.
Okay, aye from Dr. Sims.
Aye.
And aye from Mr. Bricken. So the motion is approved unanimously. The agenda is approved. Okay, item 2 is the consent agenda. The minutes from our December 1st, 2020 meeting, property tax refunds and adjustments, and the budget amendment from the Health Department, COVID-19 vaccination admin fee.
Mr. Chairman, I'll make a motion that we approve the consent agenda as presented.
Second.
I second it.
Okay, we have a motion from Commissioner Gatewood, seconded by Commissioner Mims and Commissioner Sturtevant to approve the consent agenda as presented. Any discussion? All in favor, let me know by saying aye.
Aye.
Aye. Aye. Aye.
Okay, all right. The consent agenda is approved unanimously. And no public address to the board. Okay, next is appearances. Dr. Thompson, an update on COVID-19.
Thank you, Mr. Chairman. And for those, are we live streaming?
Yes.
Yes.
Yes. For those at home joining us, thank you. It's good to see everybody. I know you have other things on your agenda. We could talk for a long, long time about the virus, the rollout of the vaccination process in the county. So I'll keep my remarks relatively short, and then we'll be happy to answer your questions. With me this evening is our nursing supervisor, Dana Thomas, our preparedness coordinator, Yvonne Burr. The two of them bear a lot of the responsibility for the management of the pandemic, and now particularly as we're rolling out into the vaccination phase. I'll start with the numbers. As of today, we are at 1,546 total positive cases. We have our highest ever 168 active cases. And unfortunately, in the last 24 hours, we've had 2 additional deaths for a total of 31 deaths. To put that number, 1,546, in perspective, when the Board of Health met in November, we had 800 cases. And it took us from March to November to get to 800. In the last 60 days, we have doubled that number. The virus is widespread in the community, and I think we will we're seeing about 20, on average, about 20 new cases a day, and I expect that will continue for a while anyhow. Based on the number of customers, the health department, at least in the short term, that is vaccinating what we would call the general population in the county. We're hopeful that others, like the Anson Regional Medical Services, will decide to become an enrolled provider and be able to help vaccinate. Also, as the primary care practices start vaccinating their patient base, if you are a patient, say, of Union Family Practice, and you meet the criteria for being vaccinated, you'll be able to go to Union Family Practice and get your vaccination. I think that by, I don't know, I'm guessing, summertime anyhow, there will be multiple places where people that want to get the vaccine will be able to go and get it. Sort of like how you get your flu shot now. You can get it at the health department, you can get it at Walmart. But for right now, with the limited supply of vaccine, the only place the general public is going to be able to get it is the health department. We will probably finish our Phase 1A occupational groups this week. And we are starting to schedule, and we'll be rolling out the Phase 1B, primarily the 75 and older that's in that Phase 1B. Our ability to vaccinate is and will be impacted greatly by 3 variables. And each one of them are important. The first one is obvious. That's the availability of the vaccine itself. If you don't have the vaccine, you can't vaccinate. The second one is probably the most important. And that is the resources that we have at the Anson County Health Department. With only 20 people, we're one of the smallest health departments in the state of North Carolina.
Especially about the email, but all over Anson County, to tell them to get their seniors ready. But this is still my question. This is still my concern. And Yvonne, you have truly helped me. I appreciate you with it. But I have seniors that's 80 and 90 years old that do not have a cell phone. They do not have a computer in their home.
Ms. Francine, you have them contact us. We're working as best that we can with that. There are some stipulations that we still cannot control. But we don't want anybody not to get a vaccine that wants it. So just have them call me and we'll do what we can to work with them.
Please, cause this is just, that's my concern.
And that's our concern too.
There's a lot of them that truly need that vaccine. Now, as Dr. Thompson said, some of them's reluctant. Not little seniors, but some people are reluctant to taking it, and they want to see how, it works on someone else or what the side effects is and all like that. But the ones that really want to do it, when their time comes, I don't want a email address hindering them from taking a shot.
I would agree.
We don't either. That's what I say. Just have them contact me. I've had several calls today. We've been able to work through a lot of it. So.
Mrs. Burr is doing a fantastic job.
She
I
really.
know personally she's really doing a great job on help you out.
Dr. Sim, if I could go in her house and cook for her every day, her dinner would be done when she get home. See, I
It'd be
do
a great
it,
dinner.
and me and Coleman would play all day, so she wouldn't have no food when she got there.
Well, thank you, but I cannot do it without the staff. I mean, Dana's wonderful to work with. All the
But
nurses
those
and
I
all.
thank you.
We always
I
do
thank
it
you
as a
for what
team.
you're doing.
I do too.
Okay, anyone else have any
And my
questions?
senior citizen taken care of.
Okay,
This is Brick, and I had a question.
okay, go right ahead.
Okay, even though you probably already explained this, but if
post-COVID, county employees rather, I believe it's the best policy moving forward and not requiring people to be vaccinated to maintain their employment. Again, that would be adding a new condition to employment that didn't exist at any point. But I do support the health director's requirement or encouragement of the vaccine. I understand that completely. I also understand that once you receive your vaccination, you will still need to wear a mask. You will still need to be socially distant. You will still need to wash your hands. The vaccine is not a panacea. The vaccine is one of a tool in a large toolkit to help you stay healthy. And I think the county needs to provide as much as possible those resources. But mandating, I think, is the wrong step to go.
Is there some way we could incentivize county staff to get the vaccination?
Something we can look into.
All right, thank you.
I don't think that should be up to us to do. I'm like Mr. Monroe. That's
I will say that a lot of staff that I have talked to and stuff now that have called me have said, we just want to wait and see. We just want to wait and see, and stuff now. And I have received mine and everybody's like, oh, I'm gonna see how you do with it, and all. And so I think the more that you go and the more studies and the more tests are done, I think people will be more prone to get the vaccine. But you don't want to rush anybody to do that, and stuff now. That's like I said, like Mr. Monroe said, excuse me. You gotta find out what's good for your body, what's good for your health and stuff like that. So everybody's different, so it does take a lot.
All right, thank you.
That was all. That was what the first recommendation was. The second one was number 4, which was double accumulation of leave. You get 7.5 hours per month for sick leave. During the course of the pandemic, however, we'll like to give another 7.5 hours. That way, it have pandemic leave. This was thought to help with the potential need of extra time, given that people's families, their jobs, and any other things the stress might impact their performance. And so having extra time off, we thought would be good. The department has suggested that, recommended that, and that's why I'm bringing it back to the board, a combination of 3 and 4 that we presented to you last month as the next step in the COVID leave package. So if you would like to vote on that.
Okay, yeah, I
have a
think
question.
now we have, okay, Mr.
When will we monitor to look at that again after the pandemic is over? Will we gonna do it for a year, or how long is we gonna monitor for it?
The pandemic leave, the option 4 would be just for the duration of the pandemic. So as soon as the pandemic leave as soon as the pandemic in particular, is dramatic in regards to the service that we can provide to our employees and to our citizens. As such, there looks to be no real headway coming forth. The infection is severe, is strong, and it continues to spread. And as such, I would like the board to consider reducing our hours of service to the public, the way that we did in April 2020, to get a hold on our employees' health and better to serve the public. We're not talking about closing government down completely, but looking at a reduced schedule. Where available, make appointments. Where available, make only phone contacts. Where available, send in emails. Where available, do things to keep us safe and distant. Internally, we will be rotating schedules from, not everyone will be in this building at any given point, because that's how we got this infection right now, was that employees came in, they all worked together, and they all got sick together. To prevent this from happening in the future, I would like to be able to rotate our schedules and reduce the number of people in this building at any given time. It's going to be very similar to what we did in April. The department heads have already been instructed to come up with a schedule that will mimic this, so they already had this instruction from last week. I would like to get support from the board to move forward with this, because this pandemic is not going away. According to Dr. Thompson, and from what we've seen with the data, after every holiday, there's a surge. Well, we just had 2 holidays, and we're going to have a surge. And we're going to make sure our employees are going to stay safe, and we're going to make sure that our citizens are safe as well. So I'm asking for support to do this, effective Thursday, January 7th. And it'd be for the duration of the month of January. Upon coming back to the board, see if we need to have an extension of that time period.
So what will be the operating hours, Mr. Monroe?
Operating hours will be the same. It's going to be the number of people in this building and the service that's provided. So instead of having a full 20 people in this building, we're going to look at having it be 10 people, and instead of having people get served within 10 minutes, it might be 20 minutes.
Yes, sir.
It's going to be times in which people are going to reach out to you and complain that we're not doing the best, highest level service that they expect, but it's going to be because we're going to have reduced manning in this building and in all buildings going forward.
Well, I would think, Mr. Monroe, I don't know about the other commissioners, but, you know, when you put this in place, or when we put this in place back in April, I think the public was pretty understanding. And even though the government center wasn't impacted then like it is now, and with the situation we got, I'm thinking we can speak to it if we do get any complaints.
I'm sure that the general public would not wish to come into a government center in the past few weeks and will not complain.
Exactly.
Well, like you said earlier, Mr. Monroe, the ones just need to make an appointment, just need to just call and make an appointment.
We'll make it available to them that they can get that resolved.
Right, resolve the appointment. That's right.
Okay, you've heard the recommendation from the county manager, and I'm not gonna try to repeat everything he said. I just say we'll go back to what we had in place in April of this year for COVID-19. So we'll need a motion to that.
I'll make a motion to approve the county manager's recommendation.
A motion coming from Commissioner Gatewood to approve the county manager's recommendation. Is that second?
Second.
Seconded by Commissioner Mims. Any further discussion? All in favor, let it be known by saying aye.
Also, Chairman, would this also include child support?
It will include all employees, and particularly with child support, we're working on getting them a remote access to their computers. That's a project that we're working on right now to minimize their time in the office. So I know about child support, and we're working on it.
Okay, anything else? Okay, all in favor, let it be known by saying aye.
Aye.
Opposed, the like sign.
Aye.
Okay. The motion passes unanimously. The county manager's recommendation is approved.
The next thing, just so you will know what else we're going to be doing over the next several weeks, we're going to really focus on our employees' health. We're developing questionnaires, we're taking temperatures, we'll be keeping logs. We are also going to be assertive in our personnel policy. Individuals will not be able to come to work sick. If they come to work sick, they will be given a written reprimand, and then it goes up from there. We're talking anything and everything from being written up to termination, depending on the severity of the situation. We won't any longer be spreading the disease to each other, and we'll mitigate as best we can spreading the disease to the public. But this is a very serious situation. As you all know, what's taken place over the last 3 weeks, and I take it very seriously. We won't be having this problem again from employee spread. The next thing is, I had on here audit status. Is Carrie on the line?
Mr. Garner.
I'm here, can you hear me?
Yes, sir.
Okay, so, Barry, you want me to speak to this now, right?
Yes, sir. Yes.
Okay, sorry, the not being there's a little weird. Okay, so, we are unscheduled. That's the part you probably should take away from this. The new software has been extremely nice. However, there has been, a learning curve along with that. We will have a tough push in the next few weeks, particularly with the scheduling that we discussed here just recently, or just prior to this. The great part about this is that last year, when we did 2019, they unveiled a portal when they started pulling testing that we could load things to the portal and we're not subject to email size document scan sizes. So us being closed to the public, we kind of already went through that in 2020 when we were doing the 2019. So that will not impact us, not one bit. We did get some good news, and I didn't even think about it, but the Corona Relief Funds will be an issue for 21, but not 20 because we didn't have any expenditure, so there's no testing there, so that saves us. I'm estimating that we will add probably another $1 million to the fund balance, to the unassigned fund balance.
That it'd be a real good one. So I guess February with that information.
Okay, that's no problem.
All right, thank you.
Sir. All right, thank you.
And thank you, Mr. Monroe, for looking into it, and Mr. Garner.
Not a problem, thank you, sir.
Just that teaching.
Okay. Next, I had on here regarding, this is dealing with, again, COVID-19 impacted service areas. Right now, tax and restaurant deeds have gone through a significant amount of hardship. One of the things that we have set aside, and I support this 100% with the board, is that we have a tax conveyance form. In order for property to go from person A to person B, they need to check to make sure their taxes are paid before they transition that property. I think that's a good policy. I support it. However, knowing where we are right now, I ask that the board suspend that transaction fee, that transaction for 1 month, to allow transactions to take place without having it signed off by the tax office while we get ourselves healthy and back together, to not delay people's transactions. And we can always collect those taxes on the back end. This is done to be preemptive beforehand. Person A will have to pay the taxes before they transfer it to person B. But right now, we don't have, right now we're in disarray. So for the month of January, I'd like for you to suspend that so that we can go ahead and have these people still make those transactions and we can collect the taxes after person B has the property in hand.
But it will be collected from person A, is that what you're saying?
It will be, that I don't know. But once it goes to person B, that person B becomes responsible for those taxes.
What I was thinking.
They become responsible for those taxes, so we'll have to get it from that person, but we'll be collecting those taxes at that point. Normally, we would do it prior to this, but given that we have so much disarray,
Right.
I'll have to suspend that transaction conveyance for at least 1 month, and in February, get back to being normal.
Okay, we've heard the county manager's request to suspend taxes on transfer of property for the month of January.
Yes. for the month of January 2021.
Okay.
I make a motion, we approve that with the add that we'll let attorneys know that without that paperwork being approved through the tax department, that they're letting the client know that Part B will be responsible for the taxes instead of
Correct.
Part A.
Correct.
I second the motion.
Okay, we have a motion from Commissioner Mims and a second from Commissioner Gatewood to suspend the taxes for the month of January 2021 on the transfer of property.
On the transfer, yeah, tax conveyance on transfer of property.
Tax conveyance on transfer of property. Okay. Any discussion? All in favor, let it be known by saying aye.
Aye.
Okay, we heard from Dr. Sims.
Aye.
Okay, Commissioner Sturgill, Commissioner Bricken.
Aye.
Okay. Okay, the motion is approved unanimously. All in favor, all opposed, let it be known by saying aye. Okay, the motion is approved unanimously.
Okay, so sorry, cause I jumped around a bit. I'm just gonna swing back around, and I added some steering committees. This is something that we are undergoing 2 big projects. We're completing our land use comprehensive plan as we speak, and we are going to enter into a zoning ordinance development process. And in order to make that as best and robust as possible, we need representation from across the county. I'm asking that the board select one person from their respective districts to sit on the zoning ordinance community. It's people in the community who are interested in being there. The planning board is separate because the planning board will have to approve this zoning ordinance as well, or give it a blessing on it. This is more of the ground roots of people who live within your communities that might want to have input into this. Again, with the land use plan, I selected 14 people. I ran it past the board. That went okay, but I think maybe the board wants to have some more input in something with zoning ordinance, because the zoning ordinance is going to be a law. It's going to be local jurisdictional law, and I think that the board should have some say in who gets to say how that develops. Excuse me. So it's going to be different from the planning board. Yes, sir. The planning board has many functions. This is going to be specific to zoning.
And how long will these individuals serve on this committee?
Well, the plan is for 1 year, but we don't know how long this is going to take. A lot of public input is required, but given the COVID-19 situation, whenever you have a meeting, you have to coordinate now with virtual meetings. You have to make sure that people are safe and distanced, and it might take longer than 1 year, but the plan is 1 year.
Okay. Is this something we can do by acclamation? Do we need to do a motion? I'm asking now, Mr.
Again, this is just my recommendation to the board. If the board chooses not to want to do that, I can assign people and I can put people together. But I thought I'd bring it to the board as an opportunity for the board to have input.
I think it's a good idea.
I agree.
And that way,
Mr. Chairman,
is involved.
Okay, thank you, Mr. Sturgeon.
Chairman,
Dr.
I'm
Sims?
having trouble hearing Mr. Monroe. Can you tell me in just a couple of sentences what he was saying?
Okay, basically, on this item, the steering committees, he's asking each commissioner to select someone from their district, a citizen, to serve on the steering committee for these items, the zoning, ordinance development, and the comprehensive transit plan. That way we'll get input from the community.
Understand?
Oh, now, okay, wait, Chairman, he's saying, so I would pick one person for VOD and one for CTP?
They could be the same person if you
Or would
chose.
That same person, that's what I was thinking.
They could be the same
It could go
person.
either way.
Right?
It could be the same person. I think, if the board's okay by acclamation, it sounds like we wanna do it, and we can do it by motion, or we can do it by acclamation. What's the pleasure of the board?
Well, I would just ask that we have it names to me by next meeting,
Okay?
so we can go ahead and
Yeah,
start the
yeah,
whole process.
I like it.
Okay, so by acclamation, each commissioner will bring the names of one person to serve on the, two steering committees, and we need to have it by the next meeting, okay?
And if anyone needs more information about what the zoning ordinance looks like or what the CTP is, I can get you that information in a week.
Okay.
And, Mr. Monroe,
Yes, ma'am.
and, our clerk, send me the information, exactly what each, like what the ZOD exactly, so when I ask the person, I can show them exactly what they will be required to do.
Yes, ma'am. Yes.
Thank you.
Mhm.
I know who I'm, yeah.
Okay.
And the last one that I have on my list is retiree recognition. So let me find it. One of the first instructions I was given when I came to the county was that we should recognize those who have served with the county and retired as employees, long-term employees. So if you turn to page 28, I'll go through the list of individuals who have served with the county and retired recently in 2020. Daniel Gatewood, Anson County Filtration, 30 years. Leon Gatewood, Anson County Wastewater Treatment, 30 years, 2 months. Sylvia Jeter, Anson County Wastewater Treatment, 37 years, 3 months. Kathy Welch, Anson County Department of Social Services, 16 years, 10 months. Vanessa Moore, Anson County Sheriff Office, 9 years, 1 month. Vicki E. Clark, Anson County Department of Social Services, 24 years, 4 months. Patricia Williams, Anson County Sheriff Office, 23 years. Judith D'Angelo, Anson County Tax Assessor Office, 12 years, 4 months. Tanya Meacham, Anson County Department of Social Services, 6 years. That's the list of our 2020 Anson County retirees. They served this county well, and now they're on to a second phase. So they would normally be here in a normal situation, but today, obviously, they're not. So that's our 2020 retirees.
All right. Thank you, sir.
And that's all I have.
All right. Okay, thank you, Mr. Monroe.
Congratulations and very much thanks to these people.
Some very long-term service employees have retired. Okay, next item on the agenda is the chairman's report. My first item is the county manager's review. We need to get this done. I've asked the clerk, Ms. Cannon, to email us as well as mail a hard copy of the review form. As we all know, I think some of us filled them out last year and we didn't do it. So we needed to get this done, and anybody needs any help, get up with me. And I know the two new commissioners may not be able to do it because you have not worked with them. I'll look it over and see if there's anything that you can contribute and let you know. But mainly it's for those that have been here, and we would like to be able to have that done by the February meeting. So we'll work towards that goal and go from there. That's something I really think we need to do. Okay, I did attend the North Carolina Association of County Commissioners Development Finance Toolbox. That was December 8th, 9th, and 10th. It was very enlightening. Learned quite a bit about debt service. I didn't see a whole lot of opportunities out of some of what they presented as far as financial arrangements with private investors. So I don't know. We'll see if something like that comes up, then maybe it can work. I don't know. The Legislative Goals Conference is January the 13th through the 15th. that starts on, the 13th at, I think it's 5 p.m. And then it's 9 to 12 on both the 14th and the 15th. And you also have a, letter in your packet that I got from the Board of Education about the, teacher supplement, and, had a conversation with the county manager. Basically what I'm understanding is to get back to where it was, because we did cut it. That's basically it.
Advantage until we, make these supplements. When I was superintendent, I just refer to that simply because it's part of, problem. I had many businesses that were planning on considering Anson County to place their business. And the first thing they asked about, and the first thing they came to talk about, was the quality of the schools. If you lose business because you have less quality of teachers due to losing these supplements, in the long run, you may very well lose money, a lot more than you gain by cutting those supplements. That's my concern.
Okay, all right, thank you, Dr. Sims, and I guess just to kind of, supplement what he said, the information I have is Anson County's current supplement is $1,152. Just for informational purposes, Richmond County's is $1,494. Montgomery County's is $2,000. Stanley County is $2,164. And,
There you go.
Scotland County is,
South Carolina's better.
Scotland County is 1,973, I believe, so you see what kind of competition we have. And I think these are counties in a sense similar to Anson County. Okay, is anything else?
Montgomery's, they're better off financially than we are either.
Correct. Okay, is there anything else to come before the board tonight?
Yeah, I have a concern,
Oh, okay.
Chairman.
Yes, ma'am. Okay, Commissioner
Hello?
Sturman?
Hello?
Yes.
I hear you.
Oh, okay, Chairman Woodburn.
Yes, ma'am.
I spoke with you about, something going on at Great Senior Center, and you were gonna get back with me after you talked to Mr. Monroe. But, the other concern I have, I don't know if you guys are aware that, Mr. Jake Barbie has left us and taken a position in Union County. My concern is we are losing a lot of our good employees
Okay.
because they're going to work in another county. And not just because of money wise, but because of the way they're being treated or not being appreciated, and we need to address that issue. We need to really, because all the time that a person leaves, it's not because of money.
That's correct.
Yeah, sometimes people just want to be treated right.
Yes, ma'am, and, I am gonna follow up with you. I did have a conversation with, Mr. Monroe about what you, made me aware of, and we
Yes,
will
sir.
get,
She's been offered a position somewhere else too.
okay,
And we don't need to keep losing employees.
point well taken. Okay, anyone else?
This is Commissioner Bricken. I just want to make sure that my vote would not be to have a mandatory shot. I know it's a little late to bring that up. And then secondly, I would want county employees that are not healthcare workers or first responders to not get a priority over the general population and still wait in the same order that they would be for those that want the shots. That would just be my statement.
Okay. Okay, all right, thank you, Commissioner Bricken. Anyone else? Okay, if not, at, this time, we thank everybody for participating, and, stay safe, remember, wear your mask, wash your hands, social distance, and, stay safe. So this time, we'll entertain a motion to adjourn.
I'll make a motion that we adjourn.
Okay, we have a motion from, Commissioner Gatewood. Is that second to adjourn? Second by,
I second.
seconded by Commissioner Mims, Dr. Sims, Commissioner Sturtevant. All in favor, let it be known by saying aye.
Aye.
Alright,
Yeah, I don't think there'll be any
Shannon,
opposed.
you do an excellent job.
Thank you, ma'am.
absolutely.
And Mr. Monroe,
Yes, that is
and
correct.
Chris, and our county attorney, in fact, all of our
Thank you.
employees, especially over the last 9 months, have done yeoman's jobs.
That's exactly right.
I certainly agree.
And yeah, thank
I
the tax,
agree.
the finance
I
department for
agree.
stepping up the taxes to you.